We are underrepresented in across all ethnic groups in terms of public health, in terms of doing work in Asian American health. And so it would be great if the next generation of our young people come in and think about exploring a career in Asian American health. Sure. The mission is simple. It's to understand, address, and reduce health disparities in Asian American communities through research, training, education, and partnership development. So the Institute for Urban and Global Health was established in 2000, and through some of the work that was supported through that institute, there was several scientific committees, one focused on Asian American populations. We met for several years, and then this RFA came out from the NIH to look at health disparities in minority populations, as well as medically underserved populations. Looking at that RFA and also knowing the work that we were doing with the Institute for Urban and Global Health, as well as our community partners in the Chinatown community, we thought that we were poised to submit an application to focus on Asian American health issues. And so we worked together in early 2003, myself, other colleagues here at NYU, the Charles B. Wayne Community Health Center, individuals from Gouverneur Healthcare Services, the Chinese American Planning Council, among other community organizations, and applied for this the center grant, which was eventually supported in the fall of 2003 and established the NYU Center for the Study of Asian American Health. So more or less I've been involved from the very beginning. So the center has evolved considerably since it was first established in 2003. We began with working with partners primarily in the Chinese American community and the Charles B. Wayne Community Health Center. And some of our initial research projects were focused on mental health issues in Chinese American populations. There was several projects focused on looking at language barriers. But we have evolved our work considerably to expand to other populations. We do a number of projects in the South Asian community, in the Korean community. We have a project, we just finished a project, an 8-year project in the Filipino American community. So the center has 4 scientific tracks, one focused on mental health, particularly issues related to some of the stigma, some of the challenges to mental health access and utilization of services. We know that Asian Americans have high rates of depression and anxiety, but maybe not much more than other populations, but they have lower rates in terms of utilizing services. There's also, for whatever reason, high rates of suicide among certain segments of the community, subgroups, as well as along gender lines. And we also have a track focused on what we call tumor genesis, which is essentially the relationship between viral and bacterial infections with cancer. So, for example, hepatitis B and liver cancer, H. pylori and gastric cancer. And we have our third track is focused on cardiovascular disease and diabetes. And finally, our fourth track is what we call our social and cultural determinants of health. We have an extensive community partner network that is comprised of over 50 community partners and sectors in the Asian American community in New York City. We grew from about 10 to 15 in 2003 to over 50 since that time, representing diverse communities. And they range from faith-based organizations to community organizations that provide social services, that help with language access, facilitating health insurance access, to local community leaders and champions. So from the very beginning, our center has employed a community-based participatory research approach to developing partnerships. We are very much a research center, but we believe this community-based participatory research, a CBPR approach, is really critical in fostering ownership. And what that means is that community partners and academic partners are working together to identify health priorities, identify the potential means for intervention, working together to look at survey instrument tools, look at the questions to be asked, getting a better understanding in terms of how to analyze the data, how to evaluate that information within the context of the communities that's being reached. And so we've used those principles to really shape how we develop our research. The major challenges for us in terms of doing CBPR is that it is very time and labor intensive. It involves maybe beginning with the partners to think about what are the problems, to think about whether or not they have the capacity to participate, as well as think about what are the things that we need to do to help improve their capacity. So, for example, we may sponsor what we call learning exchanges, opportunities to help our partners better understand why do research, how to do research, what are the things that we need to be cognizant of when we do research. And the other thing that's really time and labor intensive too is the fact that many of our community partners who are actively engaged in our research are organizational partners, but these organizational partners are very much dedicated and committed to addressing the social needs of their communities, and they're also very much supported on soft money. So it's very hard for them to commit long-term discretionary amounts of time to participate in that kind of engagement. And so it really involves not only securing buy-in from them, but also helping to support their capacity to participate, recognizing their contribution in whatever way we can, and also recognizing that there's going to be issues related to changing organizational agendas and vision, as well as changes in the staffing that might affect participation in a research project. So certainly it is very time and labor intensive in terms of building relationships, in terms of maintaining relationships, but it's also highly rewarding when we see among our partners that we actually have helped to build their capacity, when we see that they have garnered other grants, funds to support health issues, health projects that are not directly related to the project that we had involved them with. When we see that their own sense of empowerment in terms of creating their own research agenda. Well, one of the challenges that we have had to confront, and many other organizations and academic institutions probably have faced too, when thinking about working with the Asian American population, is the whole notion of the model minority myth, that we're healthier, wealthier, and wiser in many ways, and that works against us with mainstream society in many ways when it comes to funding, when it comes to prioritizing health issues and allocation of resources. It also works against us within our own populations because many of our communities on the outside feel that they are healthy. They have lower BMI. They have a very strong immigrant sense of work ethic, and so they're not thinking that they're at risk for health issues. And so for many of our communities, it's hard sometimes to do the prevention piece. It's only when they're diagnosed with an illness that it becomes a little easier for us to help in terms of addressing a health issue, or when we can identify champions, individuals who have faced their own barriers, their own concerns related to whether it's diabetes or cardiovascular disease in general, or even a mental illness, to have champions in the community to help us overcome some of the barriers in terms of having a chronic disease, and in the case of diabetes, which for many people, their concerns in terms of being genetically related. And someone has diabetes, the next generation might be at risk for diabetes, and so. And that also is related to the issues, stigma associated with cancer and mental illness and suicide. So certainly there are many barriers in terms of some of the health challenges. So for example, Project Aspire was a project that was developed both in part in terms of convening a few grassroots community organizations serving the Filipino American community in the New York, New Jersey area, working with them to develop a community forum to elicit understanding, information about what the community perspectives were in terms of their health challenges. doing a needs assessment that helped to quantify for us in terms of what people thought was a major priority. Cardiovascular disease and hypertension came up many times during the forum, many times during the survey, and then as a byproduct of working with our community partners in the Filipino American community, they were really excited about the fact that people were talking to them about health issues, and they felt empowered and they wanted to continue that momentum. So they formed their own coalition, the Kalusugan Coalition, to really think about not only health, but social well-being for Filipino Americans in the New York, New Jersey area. And so our center worked with the Kalusugan Coalition to jointly develop an application in response to a request for application that NIH had issued, and that application supported Project Aspire. So it was certainly a project that very much emanated from the community and was also informed by the data as well as qualitatively what the community members were concerned of. And also the intervention was informed by the community in terms of thinking about applying a community health worker approach to helping improve hypertension control among Filipino Americans. So the advice that I would give to the next generation of researchers is to really think about doing health disparities research. We need more young individuals to come and work in centers like our centers to help actually create other centers. We're only one out of 76 plus centers that are funded by NIH, focused on health disparities in Asian American populations. We don't have the capacity alone to do it, but we need our young people to come in to think about public health, to think about health careers, and to think about doing work in the communities. We also have we're not underrepresented in certain ethnic groups in medicine, but we are underrepresented in across all ethnic groups in terms of public health, in terms of doing work in Asian American health. And so it would be great if the next generation of our young people come in and think about exploring a career in Asian American health. When I started out more than a decade ago, there was nothing, and people thought that there wouldn't be much to do in terms of minority health in Asian American populations. Most of the focus was on other communities, and so. But I found in my own experience that there's so much to be gained, and that you can have a very rewarding career focused on Asian American health disparities.